Welcome to the deep dive. Today we're tackling a really important topic, understanding and managing high blood pressure, or hypertension as it's formally known.
That's right.
You, our listener, have shared some great resources with us, and we're going to focus on a specific situation, a case in Singapore actually, to pull out the crucial insights about dealing with this condition.
Exactly. And we're looking specifically at the case of a Mr. Tan. He's 50, lives in Singapore, and he's had high blood pressure for about 10 years.
And it's not well controlled currently.
No, it isn't. So our mission really in this deep dive is to use your sources to understand why those blood pressure targets matter so much, for his long-term health.
Right. And what gets in the way?
Yes. What commonly gets in the way of sticking to medication, making those lifestyle changes, and maybe what practical steps someone like Mr. Tan can actually take.
Okay, let's unpack this then. Starting with Mr. Tan himself. So 50 years old, diagnosed a decade ago, and his current reading is 150 over 95 millimilli-H.
Which is definitely elevated. The
Good.
target's usually below 490.
Right. He's on amlodipine, that's a pretty common medication, 5 milligram dose, and he does mention occasional mild headaches.
Mm-hmm.
But here's where it gets, well, really interesting and probably relatable for many. He admits he sometimes forgets his medication, especially, when mornings are hectic.
A morning rush, yeah.
Yeah.
Very common.
And he's finding it tough to change his diet and exercise habits, work, family commitments, the usual
It's
suspects.
the reality of daily life, isn't it?
Yeah. And we also know he doesn't check his blood pressure at home. His recent blood tests, though, they showed his kidney function is normal, which is good news.
That is good.
But his LDL cholesterol, that's the bad cholesterol, is a bit high, 3.4 millimol.
Okay. So what's really striking here is just how typical Mr. Tan's situation is. For so many people managing these kinds of ongoing health conditions.
Great, you get the diagnosis, you get the prescription.
Exactly. But then life happens. Remembering the meds, finding time, finding the energy for healthier habits. It all comes into play.
And those headaches he mentioned, could they be linked to his blood pressure?
They could be. Fluctuating blood pressure can sometimes cause headaches, but it's also really significant that he often feels okay.
Ah, yes, the I feel fine trap.
Precisely. Which can unfortunately lead people to think that, well, maybe strict control isn't always necessary. Hypertension is often called the silent killer for a very good reason. You don't always feel it.
Right, which brings us straight back to the importance of hitting that target. You said below 140 over 90 millimilli-H.
Yes, for most adults under 80, that's generally the recommended target.
So why is getting that number down so critical for someone like Mr. Tan? What's the real risk here?
Well, if we look at the bigger picture, consistently high blood pressure like Mr. Tan's, 150 over 95, it dramatically increases his chances of really serious health problems down the line.
Like what specifically?
We're talking major issues, things like stroke, heart attack, kidney disease. Hypertension isn't just, a number. It's a primary driver of cardiovascular disease.
And that's a huge public health issue, right? In Singapore and globally.
Absolutely massive. And your sources highlight a really powerful point here. Even small reductions in that top number, the systolic pressure, say every 10 millimillimeter G you manage to bring it down,
Yeah.
it can lead to a really significant drop in risk. We're talking roughly 40% reduction in stroke risk and about 35% for heart disease.
Wow. 40% lower risk of stroke just from a 10-point drop. That's huge.
It's incredibly significant. Think about that, almost having your risk for stroke just by managing that pressure better. It really underscores why getting it controlled matters.
And we also mentioned his LDL cholesterol was a bit high. That adds to the risk too, doesn't it?
It certainly does. It's another layer.
Yeah.
High LDL cholesterol contributes to plaque buildup in the arteries. You combine that with high blood pressure, and it just accelerates the risk of blockages, leading to things like heart attacks.
Okay. And there's family history to consider too.
Yes, that's another important piece. Mr. Tan's father had a heart attack relatively young at 58, and his mother also has hypertension.
So that genetic predisposition.
It really highlights his personal vulnerability, his own risk, and why getting on top of this is so important for him specifically.
Okay, so we understand the target. We understand why it's vital. But let's go back to Mr. Tan's challenges with his medication, the amlodipine. He mentions forgetting it, especially in the morning rush, and sometimes just feeling okay, so maybe thinking he doesn't need it that day.
Right. The feeling okay misconception again.
And he also mentioned occasional mild ankle swelling, which he sort of links to the medication and sometimes uses as a reason to skip a dose.
Okay, so this really gets to the heart of medication adherence, doesn't it?
Yeah.
What gets in the way? Forgetting, especially with a once-daily pill, is incredibly common when routines get disrupted. We all experience that.
Absolutely.
And feeling okay is, as we said, really misleading with hypertension because the lack of symptoms is the norm, often until something serious happens.
And the ankle swelling.
Now, that's a key point. Ankle swelling can be a side effect of amlodipine. Amlodipine is a calcium channel blocker. It works by relaxing blood vessels.
Okay.
But it's really crucial that Mr. Tan discusses this side effect with his doctor, rather than just deciding to skip doses himself.
Because skipping doses just keeps his blood pressure high.
Exactly. It undoes any benefit and leaves him unprotected. His doctor needs to know about the swelling.
So what helps with the forgetting part? The sources mention some pretty straightforward strategies.
Yeah, relatively simple things can make a big difference. Using pill boxes, for instance, to organize doses for the week. Setting reminders, phone alarms, calendar alerts.
Or linking it to a daily habit.
Precisely. Linking, taking the medication to something he already does every single day without fail, like brushing his teeth or having his first cup of coffee,
Right.
making it automatic.
Right. Build it into the routine.
And regarding the ankle swelling, talking to the doctor is essential. It might be manageable, maybe the dose needs adjusting, or perhaps there's a different type of medication that would suit him better.
So communication is key there. Don't self-adjust.
Absolutely. Open communication with the healthcare provider is vital.
Okay, let's shift gears now to lifestyle. This is often the hardest part for many people, including Mr. Tan. Sedentary office job, long hours, 8:30 to 6:00.
A long day sitting down.
Yeah. And for lunch, he relies heavily on hawker centers. He mentioned liking chicken rice, char kway teow.
Classics.
Yeah.
Delicious, but potentially problematic.
And dinner is often late and frequently takeaway. And then exercise. The classic reasons. No time. Too tired after work. I think many of us can relate to that.
Oh, absolutely. The Singaporean context here presents some unique challenges and opportunities, especially around food. Hawker centers are fantastic, convenient, affordable.
Part of the culture.
Definitely. But many popular options can be quite high in sodium, unhealthy fats, and calories. Mr. Tan's favorites, chicken rice, especially if it includes the skin, char kway teow, which is often quite oily, mixed veg rice if it comes with lots of gravy or fried items.
Yeah.
They're very typical choices, but they can certainly contribute to higher blood pressure and cholesterol if eaten regularly without balancing them out.
And the late dinners, the takeaways.
That pattern adds to it. And yeah, feeling too drained for exercise after a long workday is a hurdle many people face in busy modern life.
So for someone like Mr. Tan, what are some realistic changes? We're not talking about a complete overhaul overnight. When he's at that hawker center, staring down a plate of char kway teow, what's a slightly better swap?
Small, sustainable changes are the name of the game. Your sources suggest focusing on healthier hawker choices.
Like what?
Well, instead of maybe the char kway teow, perhaps opting for something like young tofu, but choosing mostly the non-fried items and going for a clear soup base.
Okay.
Or maybe a steamed fish set with rice and asking for extra vegetables. Even simple things like choosing brown rice if it's available. That makes a small difference over time.
Looking for soup-based or steamed dishes, generally.
Yes, or asking for less gravy, less oil.
Sure.
Even requesting less salt or sauce during preparation, though that can be tricky. Some stalls now have the healthier choice symbol, which could be a helpful guide.
Right, look for the symbol. And what about activity if the gym feels overwhelming after work?
It doesn't have to be structured exercise sessions. It's about incorporating movement into the day. Taking a brisk walk during the lunch break, using the stairs instead of the lift.
Just getting up from the desk more often.
Even that helps. Standing up, moving around for a few minutes every hour, it all adds up. And reducing sodium is crucial too. Being mindful that even without adding extra salt at the table, a lot of hawker food is already high in sodium from the cooking process.
So it's about making these small, manageable tweaks that fit into his actual life.
Exactly. Consistency with small changes is much more effective than drastic changes that don't last.
Now, another interesting point from the sources was home blood pressure monitoring. Mr. Tan isn't doing this currently. How could checking his BP at home actually help him?
Home blood pressure monitoring, or HBPM, offers several real advantages. Firstly, it gives you readings over the long term in your normal environment.
Not just the snapshot in the clinic.
Precisely, which can give a much more accurate picture of your usual blood pressure. It can help identify things like white coat hypertension, where your pressure is high only at the doctor's office because of anxiety.
Ah, okay.
It also provides valuable feedback, both for the patient, for Mr. Tan himself, and for his doctor. This data helps guide treatment decisions more effectively.
So it could make him more engaged.
Potentially, yes. Seeing the numbers regularly can increase awareness and might motivate him to be more consistent with medication and lifestyle. Plus, if his blood pressure becomes well managed, it could potentially mean fewer routine clinic visits are needed down the road.
That makes sense. Okay, so pulling all this together, what are the big picture recommendations for managing hypertension that we can take away from these sources? Thinking about Mr. Tan, but also more broadly for anyone listening.
Well, the sources consistently hammer home that effective management usually needs a combination approach, lifestyle changes and medication working together.
It's rarely just one or the other for long-term control.
Not usually, no. Accurate blood pressure measurement is also fundamental. Using a validated machine, proper technique, it all matters.
Right.
And cardiovascular risk assessment is key. Doctors use tools like the Singapore Modified Framingham Risk Score you mentioned to estimate overall risk and decide how intensively to treat the blood pressure.
So it's tailored.
Very much so.
Mm.
While amlodipine is a common first choice, a calcium channel blocker, there are other classes like ACE inhibitors, ARBs, diuretics. The best choice or combination depends on the individual patient, other health conditions they might have, potential side effects.
And often one drug isn't enough.
Often, yes. Combination therapy is frequently needed to get patients to that target BP level. Regular follow-up with the doctor or nurse is vital for monitoring, adjusting the plan, managing any issues.
And lifestyle is always part of the plan.
Always. The sources really stress this. Diet, exercise, weight management, moderating alcohol, quitting smoking. These are crucial for everyone with elevated blood pressure, regardless of medication. It really boils down to a personalized approach.
Considering the patient's preferences, their life situation.
Exactly. And it's worth noting, especially in the Singapore context, that there are resources available. Programs to support healthy eating, encourage physical activity. Mr. Tan could definitely look into those.
Okay, so for you, our listener, let's quickly summarize the key takeaways from this deep dive on high blood pressure. We've really seen how crucial it is to get that blood pressure down to the target level for your long-term health.
Absolutely critical.
We've looked at some very common, very real barriers for getting medication, dealing with side effects, finding time and motivation for lifestyle changes, especially with things like readily available, tempting hawker food.
Challenges many people face.
And we've explored practical strategies to overcome these, some specific to the Singaporean context, but applicable more broadly too. Small steps, consistency, communication with your doctor.
That's the core message. Managing hypertension isn't a quick fix. It's an ongoing journey. It takes understanding, commitment, and definitely collaboration with your healthcare team.
Right. And on that note, here's a final thought for you to consider. Given how common high blood pressure is, and the fact it's often silent with no obvious symptoms, what small, sustainable change could you perhaps explore in your own life right now to prioritize your cardiovascular health, even if you feel perfectly healthy today?
That's a really important question for everyone to reflect on.
Definitely something to think about, and maybe even bring up with your own healthcare provider at your next visit.
Thanks for taking this deep dive with us.